We got to talk about the measles outbreak. This week, the first death from this measles outbreak in West Texas occurred. And we're being told that it's not a big deal, that we shouldn't pay attention to it. What? Measles who? The measles outbreak has then spread to a number of states. And you can get infected even if you've been vaccinated, although it's less likely. But again, it is not a joke. And I'm going to take you through an excellent interview that Democracy Now! Did with a specialist in infectious diseases. But here's our current head of Health and Human Services on the measles outbreak. Earlier this week, again at the Elon cabinet meeting, RFK Jr. was asked about the death and what he thought.
There's a measles outbreak in Texas at the moment in which a child is reported to have died. Do you have concerns about that? And have you asked Secretary Kennedy to look into that?
Well, why don't we, Bobby, you want to speak on that?
No, we are following the measles epidemic every day. I think there's 124 people who have contracted measles at this point in Kings County, Texas. Mainly, we're told in the Mennonite community, there are 2 people who have died.
There's actually only one person who's died.
But we're watching it, and there are about 20 people hospitalized, mainly for quarantine. We're watching it. We put out a post on it yesterday, and we're going to continue to follow it. Incidentally, there have been 4 measles outbreaks this year. In this country last year, there were 16. So
there were 4 measles outbreaks this year. Last year, there were 16. Now, I'm not really good on math, but I could sure as shit tell you that if he's trying to compare 12 months to 2 months, his math is off and saying 16 versus 4. At the rate that we're going, we will completely outpace the measles outbreaks from last year, sir. And again, I'm bad at math, but I could do that. If you're comparing, what are you talking about? So once again, he's downplaying this death that was needless. And I just want to play this interview.
For more, we're joined from Houston, Texas by Peter Hotez,
Peter Hotez, thank you.
Internationally recognized physician, pediatrician, scientist on neglected tropical diseases and vaccine development. He's co-director of the Texas Children's Center for Vaccine Development and dean of the National School of Tropical Medicine, and professor of pediatrics and molecular virology and microbiology at Baylor College of Medicine, the author of several books, including The Deadly Rise of Anti-Science, A Scientist's Warning, and Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Scientists. He also wrote the book, Vaccines Did Not Cause Rachel's Autism.
Okay.
It's happening in West Texas. How unusual is this child's death?
Well, it's devastating, right, Amy? Because this is a school-age child who was denied access to the MMR vaccine, was unvaccinated. This is a death that never had to happen. And the problem is there could be additional deaths. I hope not. But, you know, those kids in the hospital are there for a reason because they're sick. You know, if you look at what happens when an unvaccinated child gets measles, on average, 20% require hospitalizations, usually because of respiratory illness, as was mentioned in this instance, because of measles pneumonia. It's a giant cell pneumonia that's very devastating, often requires an ICU admission. And that's just the beginning. Then there's dehydration from measles diarrhea. There's neurologic involvement, encephalitis, deafness, hearing loss, and the list goes on.
But other than that, I mean, it's kind of a walk in the park. It's kind of a walk in the park.
And so I think the message that we really need to understand is measles is a serious illness. In the 1980s, 3 million kids died every year from measles. It was the single.
3 million kids a year died of measles? Measles has largely been eradicated thanks to the vaccine. And we want to go back to the 80s? I made it out. this is what homie is on a very big deal.
Single leading killer of children globally. Now, through the Gavi Alliance, the Global Alliance of Vaccines and Immunization, we brought it down to 100,000 deaths, still a lot of deaths. But our vaccine ecosystem is very fragile because measles is so highly transmissible. The minute you stop vaccinating and maintaining that vigilance of 95% vaccine coverage, measles comes roaring back. And that's what's happened here in West Texas.
I mean, there were so many inaccuracies in what RFK Jr. said, among them that the people who are in the hospital are mainly there for isolation, and yet you have the doctors saying it's respiratory distress. Can you explain what happens to the body?
Yeah, what happens is when you become infected with the measles virus, and if 10 unvaccinated kids are exposed to the virus, 9 will acquire the infection. That's how contagious it is. And then what happens is you get a prodrome of what we used to call the 3 C's: cough, coryza, which means upper respiratory involvement, and congestion, conjunctivitis, followed by the rash. And the rash is occurring because the virus is getting into the bloodstream and disseminating to the skin and all parts of the body. And unfortunately, that includes what we call hematogenous spread to the lungs, and it causes a very damaging pneumonitis and pneumonia, and then can also result in encephalitis and other involvement.
Dude, I mean, but other than that, all right, doctor, I get it. But like, other than that, it's not a big deal. I mean, we are being told that drag queens and trans people are the biggest threats to children. And now the HHS secretary is saying that deaths from measles aren't that big of a fucking deal. I mean, I don't understand how any MAGA mouthpiece can wake up in the morning and say, kiss their family. Number one, they don't want to have anything to do with them. They don't raise their own kids, and their wives don't want them to touch them. But like, imagine, you know what I'm saying? No, but we're supposed to disbelieve all the doctors. Let's move on from measles, because it gets worse, guys, this week. According to New Republic, did this great reporting about RFK Jr. taking a sledgehammer to 2 major vaccine developments, specifically a project that creates a COVID-19 vaccine in pill form on Tuesday. Massive breakthrough, guys. If that happened, that would be huge. The number of people who don't get vaccinated because, they don't like the shot, or they have to go get it, and it's expensive, but having it in pill form would be huge. Fox News, of all places, reporting 10,000 individuals were slated to begin clinical trials on Monday. The trials only paused, not terminated, with Kennedy and other health officials set to examine the study's initial findings over the next 90 days before taking the next step. It was part of Biden's $4.7 billion Project Next Gen initiative, which was launched in 2023 and works to streamline the development of new vaccines. Boy, oh boy. Boy, oh boy. Kennedy said, while it's crucial the Department of Health and Human Services support pandemic preparedness, 4 years of the Biden administration's failed oversight have made it necessary to review agreements for vaccine production, including Vaxarts. Just take the reins, China. You know what I'm saying? Just take the reins. Just have it. Just take the reins. Somebody invade us. Denmark, come on. Where are the Vikings when you need them? Pillage this nation. Somebody take it over. I love where these people are so pig-headed. They're single-handedly contributing to the decline of what they think is the American empire that they so deeply laud, and that then they deliberately take us out of the World Health Organization and stop critical vaccine research. And they still want to be big and mighty and powerful and respected. Bitch, you got to earn that respect. Anyway, don't worry. He's looking forward to working with the medical experts, and including the own insane little supplement hawkers that work on his children's health defense league, or whatever the hell it is. We're going to make sure that there is plenty of supplements that only through these certain purveyors who will get rich off of, you're just going to redirect it. You know what I'm saying? I'm just going to redirect it. Beet juice. Yeah, but look, Have we ever considered the importance of leafy greens? And instead of coffee, I have heard that mud is very important. And in fact, 9 of the 10 unvaccinated children, when put on a strict regimen of drinking their own urine, found that after they both drank urine and fought one another in a UFC style game, that combined with simultaneously listening to Joe Rogan created such an immuno response as to thwart the full effect of measles. Meanwhile, in another corner of hell, the FDA's Vaccine and Related Biological Products Advisory Committee, or VRBPAC, was scheduled to meet in March to discuss the strains that would be included in the next season's flu shot. But federal officials told the committee in an email Wednesday that the meeting was canceled. Said committee member Dr. Paul Offit, director of the Vaccine Education Center at the Children's Hospital of Philadelphia. Offit told NBC News no explanation was given for the cancellation of the yearly spring meeting, which comes in the middle of a flu season in which 86 children and 19,000 adults have died, according to the CDC, which again is probably no longer tracking flu deaths. I'm quite shocked. As you know, VRBPAC is critical for making the decision on strain selection for the next influenza. Is it, first of all, this is very serious, but I do think it's really funny if like the next influenza, like the next influenza strain for the vaccine is like kind of America's Next Top Model, or like Project Runway. It's like one day you're in, the next day you're out, or like, or is it just kind of like a white smoke new Pope situation, who I hope is doing better? Oh my God. If the Pope dies, I don't think I can handle it.
We're joined now by Dr. 1,000 death target in the next vaccine, since production takes months. It comes amid one of the worst flu seasons in 15 years, with more than 19,000 deaths, according to the CDC, nearly 100 of them children. We're joined now by Dr. Paul Offit, one of the FDA committee advisors and director of the Vaccine Education Center at Children's Hospital of Philadelphia. It's good to see you, Dr. Offit. So why was this meeting in particular so critical, and why did the FDA cancel it? What justification did they give?
Well, it's critical because it takes about 6 months to make this vaccine. So every March we meet, and we meet with representatives from the World Health Organization, the Department of Defense, the CDC, and we look at a map of the world and we look at how these viruses are moving across that map as a way to predict what strains are likely to come into this country. We then pick strains we think are most likely to cause this coming year's influenza epidemic. And then the manufacturers, the vaccine manufacturers, then use that information to make the vaccine for what is a 6-month production cycle, March to September. So it's a critical meeting, and it just got canceled.
And which justification, if any, was given?
There was no justification. We don't know who did it. We don't know why it was done. We were told later that the FDA will essentially take this in-house. They're going to make the decision themselves.
Oh my God. Like, this is so terrifying. So again, this is Paul Offit. Dr. Paul Offit of the Children's Hospital. He is part of the committee that decides, again, which the next influenza strain should be used to create the flu vaccine. Now, again, flu vaccine doesn't always work, but it protects you against the most likely strain, because how do they do it, right? They see what's moving around the world. Right now, in the Southern Hemisphere, it's winter. There is more of a flu virus going around where it's colder, right? We understand that. So they use they see what vaccine or flu strains are going around there, and then they use that to develop the next one, and so on and so forth. And so part of being, in the world involves doing these kinds of things. This is part of global research. This is part of why a World Health Organization matters. And so he's told, no, this meeting can't happen. And by the way, the reason they meet in March is because it takes 6 months to develop the new vaccine of the new strain. And so they want to get a jump on it so that come Thanksgiving, there's a vaccine, or October or whatnot, when it starts to get cold. And you know what my deepest, darkest thought was when I heard about it seems like it's going to just be an internal in-house thing of the HHS or CDC. What it makes me immediately think is, I'm sorry. Do you trust a vaccine developed by RFK Jr. and his supplement psychos? Do you? Because I don't. Because here's what I think. Like, he's so obsessed with this issue that I'm like, would he not put people at risk? Right? What if he were to engineer some sort of vaccine related death in order to prove that vaccines are actually terrible and we need to stop doing them altogether? Like, who knows, man? Who knows, guys? Everyone book a trip to Mexico right now. That's where you're getting your vaccines, okay? You're going to Mexico, you're getting your health care, you're getting your meds, you're obviously going to enjoy a nice michelada or whatever, and then you're going to contribute to the local tourist economy, and you're going to come back. But you're going to be getting your vaccine south of the border, my friends. What's going on, Frantifa? If you haven't already, subscribe to this channel right now. Hit that button. And also, you can become a patron and support the show every single week. Get access to bonus episodes and exclusive merchandise. Patreon.com/Bitchuation Room. Do it.